you a breastfeeding mother wondering if it's safe to take Zofran? In this video, I'm going to discuss the safety of taking Zofran while breastfeeding and provide some helpful tips. What is Zofran? Zofran ondansetron is a medication used to prevent and treat nausea and vomiting. It belongs to a class of drugs called serotonin 5-HT3 receptor antagonists and works by blocking the action of serotonin, a natural substance that may cause nausea and vomiting. Zofran is commonly prescribed for people undergoing chemotherapy or radiation therapy and can also be used to help relieve post-operative nausea. What are the possible side effects of taking Zofran while breastfeeding? Taking Zofran while breastfeeding may cause possible side effects in both mother and baby. Common side effects for the mother include nausea, vomiting, constipation, headache, dizziness, and drowsiness. Babies who are exposed to Zofran while breastfeeding may experience an increased risk of developing diarrhea or difficulty sleeping. Additionally, there is a potential risk of jaundice in newborns when the drug is passed through breast milk. It's important to talk to your doctor before taking any medication while breastfeeding and weigh the risks against the benefits of taking Zofran. Your doctor can help you determine if it's safe for you and your baby. Is it safe to take Zofran while breastfeeding? Yes, it is generally safe to take Zofran while breastfeeding. While the medication does enter into breast milk in small amounts, there is no evidence that it will cause harm to a nursing infant when taken as directed by your healthcare provider. However, since the safety of taking Zofran when breastfeeding has not been fully established, talk with your doctor or healthcare provider before taking this medicine if you are breastfeeding. It's also important to make sure that any other medications you are taking while breastfeeding is discussed with your doctor so they can advise you on their potential risks and interactions. Additionally, monitor your baby for any changes in behavior or health after beginning treatment with Zofran. If you notice anything unusual, consult your healthcare provider right away. What are the benefits and risks of taking Zofran while breastfeeding? The benefits of taking Zofran while breastfeeding include relief from nausea and vomiting caused by certain medical conditions. The active ingredient in Zofran, ondansetron, is generally safe for infants when taken as directed. However, there are some potential risks that should be discussed with your doctor prior to starting any medication while breastfeeding. Risks associated with taking Zofran while breastfeeding includes possible interference with the infant's metabolism or excretion of other medications a mother might be taking. There is also a theoretical risk of serotonin syndrome, in which excess levels of the neurotransmitter serotonin build up in the body and lead to serious side effects such as confusion and difficulty breathing. Additionally, since Zofran can pass through breast milk, it is possible that the infant could experience side effects such as diarrhea or constipation. It is essential to consult with your doctor before taking any medication while breastfeeding. Taking Zofran can be beneficial for mothers who are experiencing severe nausea and vomiting, but the decision should only be made after a thorough discussion of potential risks and benefits with a medical professional. Are there any alternatives to taking Zofran while breastfeeding? Yes, there are some alternatives for breastfeeding mothers who wish to take Zofran. Some of these include using medications that have been specifically designed for use during breastfeeding. These may be different dosages than what is usually prescribed and should always be discussed with a healthcare provider prior to use. Additionally, lifestyle modifications, such as eating smaller meals more frequently, avoiding spicy foods and beverages that can aggravate nausea, trying relaxation techniques like yoga or meditation, and drinking ginger ale or other non-alcoholic drinks can help ease the symptoms of morning sickness without taking medication. Finally, acupuncture and acupressure can also provide relief from nausea in pregnant women. All of these treatments should be discussed with your healthcare provider before beginning any new regimen while breastfeeding. What should I do if I have questions about taking Zofran while breastfeeding? It is important to speak with your healthcare provider if you have questions about taking Zofran while breastfeeding. Your healthcare provider can provide you with individualized advice on the risks and benefits of taking Zofran while breastfeeding. They may also have additional information that could help you make an informed decision. Additionally, they can monitor your health while you are taking Zofran, as well as the health of your baby if you choose to take it. It is important not to start or stop any medications without consulting a healthcare professional first. Always follow their instructions regarding when and how much medication to take, as well as any special precautions you should take in order to minimize risk of side effects or harm to yourself or your baby. What are the safety precautions I should be aware of when taking Zofran while breastfeeding? It is important to consult your doctor before taking Zofran while breastfeeding. Although the drug has been used in a limited number of studies on breastfeeding mothers, it can pass into breast milk and may cause side effects in the baby. Be sure to discuss potential risks with your healthcare provider before beginning treatment with Zofran. You should also be aware that Zofran may interact with other medications or supplements that you are taking, including herbal remedies. Additionally, if you have any medical conditions, such as kidney or liver disease, it is important to notify your doctor so they can adjust your dosage accordingly. It is also advised to take the lowest possible dose for the shortest duration needed to control symptoms. In conclusion, breastfeeding mothers should discuss with their doctor if taking Zofran is safe for both mother and baby. There are some potential risks to consider before using this medication while nursing, but it may be beneficial in certain cases. We hope that you have found the information provided here helpful in determining whether or not Zofran is a suitable option for you and your child. If you have any further questions or concerns about taking Zofran while breastfeeding, please leave us a comment below. We'd love to hear from you. And don't forget to subscribe to our channel so that you can stay up to date on all of the latest health advice and tips. Thanks for watching.